Hi everybody, Chris Bailey here with Physical Therapy and Balance Centers, and we're reviewing a little knee talk today to go over some of the common problems in the general anatomy. So when we're talking about the knee, this is a model of the right knee here. You have the upper knee bone, which is called the femur. You have the lower knee bone, which is called the tibia, and you have this little bone out here called the fibula. And what we have is the kneecap, and that just sits in some tissue down in through here at the end of this big quad muscle. And what that does is it rides in a little groove in the upper leg bone in through here. What we see a lot of times are some issues where the kneecap doesn't quite track right, and this can be because of weakness in through this upper thigh muscle. It can be because sometimes it would dislocate or sublux, that's partially dislocate in some folks, and that can cause pain in through this area and some trauma. And it could be the cause of some continued pain with walking and steps. So one other issue that we see oftentimes is arthritis. And what happens with that is the cartilage in between the upper and lower leg bones starts to go away. So you have bony surfaces rubbing on each other that shouldn't be as much, and it creates an inflammatory response. There can be some general treatments that help this, including just strengthening some of the muscles around the joint. That will help to support the joint itself. Surgery isn't always necessary for some knee arthritis. What we see is it gets inflamed. If we can calm down that inflammation through some light stretches and strengthening, a lot of times people can have quite a few more years before they need something done for the knee. The other common injury that we see is with the meniscus. And that's like a little shock absorbing disc on either the inside and the outside of the knee that starts to get torn. And that can get torn in an injury and a fall. It can get torn when you twist on it, or just over time it starts to wear out, and sometimes you'll have pain right in the inside part of your knee, especially when you twist or turn. That unfortunately doesn't have very good blood flow to it, so it tends to not heal well, or it takes some time to heal. But a lot of times there's some really easy tests we can look at to see if that is the problem. The last thing that we see most commonly is just a general pain with some of the tendon structures around the knee. So you have an IT band that runs on the outside of the leg and through here, and you can't see it on this model, but it attaches on the outside of the leg here. So if that tendon is tight, what it starts to do is apply more pressure on the outside of the knee, which can create an inflammation or pain out through this area here. We have a video series called Active at Home, and we have one for the lower body. There's one for the hip and the lower body that also goes over some movements that are really good to do for the knee. And what they're our most common exercises for people that have any of those problems that I just talked about. And they're some of the safest and most effective exercises. So if you have any of those issues that I just talked about, go ahead and try the Active at Home program. None of the movements should hurt your knee on there. If they do, let us know, give us a call, but give that a good try for 2 or 3 weeks and see if you start to build up some strength around the knee. You improve your flexibility around some of the muscles around the knee to help with that pain. If you're still having trouble, reach out, give us a call. We could take a quick look at it. We might just need to tweak that exercise program or maybe try some of these other things to help reduce that inflammation if it's a painful or arthritic knee. Thank you.